I think we will see an increasingly earlier use of some of these more potent therapies. I think that the trend we've seen with Latitude and Charted and Stampede, I think we'll see that these therapies, as they're applied earlier, do have benefit, but it's not going to be a uniform one, and that's where trying to predict for those patients that are higher risk, who may not have as good of a response to ADT, that's where a lot of the drug development is going to have to happen, is in those higher risk patients that we think at the outset are not going to do as well, or those that after a few months of induction hormone therapy whose PSA is not declining as fast as we would like. That's where the drug development has to happen to really think about what's the next wave of therapies. The flip side of it is that as we use all these therapies earlier in the disease course, what happens then at the time of progression, when these patients are castration resistant, but they've already been on abiraterone, they've already been on enzalutamide, apalutamide, they've already had their androgen pathway potently suppressed. Are we going to see sort of a more aggressive type of cancer emerge in that setting, and how do we treat it? So I think that will also be a very relevant question for the field as we move forward.